Let's turn now to Dr. Ashish Jha, Dean of the Brown School of Public Health, to drill down on what to expect with the fall approaching. Dr. Jha, good morning to you.
Good morning. Thanks for having me on.
So let's dig in here. Today is Labor Day, and it's more likely, that there will be large gatherings that are happening. Tell me this. Should we be concerned that we're going to see this big spike, or do you think that people will heed the warning?
Yeah, so unfortunately, both after Memorial Day and July 4th, we saw pretty big spikes. I'm hopeful people will be a bit more careful this time. Again, there's nothing wrong with getting outside and going to a beach or going to a park. It's those large gatherings indoors that are really, really deadly, and that's what we have to avoid.
And, the temperatures are starting to get colder in some parts of the country, so that limits people being able to hang out outside. So is that a big concern for the fall, that more people are going to be inside?
Yes, I think a lot of us in the public health community are worried about what's going to happen this fall. As you said, the weather's going to start getting colder. People are going to start spending more time indoors. That's where the virus likes to spread. And so that's part of the reason we wanted to get the caseloads as low as possible as we entered into the fall. Unfortunately, we still have 40 to 50,000 people getting infected every day. So I think we have some work to do before it gets much colder.
Well, speaking of which, a hot topic today, we've also seen colleges having issues, keeping kids healthy, and they're cracking down. But are administrators, in your opinion, doing enough to protect the students, or what should they be doing additionally?
Yeah, so look, I'm all in for making students be more responsible, but administrators have to be responsible too, and they're the adults. And what colleges need to be doing is having a plan for quarantining, a plan for surveillance testing. A lot of colleges and universities have put in surveillance testing. I think that's pretty essential. When colleges don't do their part and then just blame the students, I find that very frustrating and personally irresponsible. Colleges have a responsibility here as well.
Doctor, we wanted to get to some viewer questions. We put the call out for questions. And Donna Naples in Florida, she asked on Twitter, my child has gone back to school. What's the best way to make sure backpacks and lunch boxes traveling back and forth each day are sanitized to prevent the spread of germs in their house?
It's a good question. I don't think you need to do anything particularly different. Obviously, wash the lunch boxes after every day. Maybe a little extra hand hygiene. So what I do when I, for instance, pick up groceries from the store is after I put everything away, I wash my hands a bit more assiduously. And I would do the same thing with lunch boxes for my kids when they get back from school.
We have a good question from Instagram. When is the best time to get the flu shot this year?
Well, most important is to get the flu shot now, later, when it becomes available. So in general, I've been advising people that as soon as the flu vaccine becomes available, people should go out and get it.
Here's another question. Do you think it's important for high school student athletes to be tested regularly?
That's a very good question. In general, I've been pushing high schools in general when they open up to have some amount of surveillance testing if possible. In terms of the student athletes, I don't know if they're at that much higher risk. It depends a little bit on what sport. So I have a high schooler who runs track. Okay. I don't know that she's at particularly increased risk, but football, soccer, where you're going to be spending time indoors in locker rooms, maybe that's a bit of a higher risk situation and more testing would be useful.
We have another viewer question, finally, something I hadn't thought of. It says, should our children shower or bathe as soon as they get home from school?
Schools are not some super high-risk place they're going into. I mean, we saw this with doctors and nurses who were working in COVID units who would come home and immediately shower. That's fine. Schools are not that. They're not super dangerous places. I don't think you need to do anything different. Maybe extra careful, like washing hands and making sure that stuff is put away. But other than that, I wouldn't do anything differently.
All right. Well, Dr. Jha, thanks for your advice and thanks for joining us this morning.
Calming presence this morning, doesn't he? Yes.
Moral of the story, keep washing your hands.
Yeah, really.
Always.